Good question. So the question is really how, as we describe it, Eastern, Western medicines meet, or kind of nature-based therapies and pharmaceutically based chemical medicines actually interplay. So if we go back and take a look at multiple different civilizations, Chinese, Indians, Persians, just for example, what we see is that there were a lot of very effective remedies that were very much plant-based. So we knew that if you take this particular plant and use it for that particular purpose, a lot of patients were actually being healed from diabetes to pain to sleep and so forth. But what they didn't know is what are the key chemicals in those plants that were actually causing those effects, and can you optimize them by being able to interweave them with others. So what we've also realized in nature is that nature has not only its problems, but also its own treatment modalities. It has its own answers. So the yin-yang in nature is truly there, which is for everything that occurs, there is an antidote for it. We just have to be smart enough to identify it. And again, to talk about the humility that we need to have in science in regards to approaching nature and understanding the healing powers of nature, is that we probably understand less than 1% of all the benefits of plants. And we've studied less than 1% of all the plants and their chemical effects in terms of health, maintenance of health, and eradication or minimization of really disease processes. On the other hand, you have pharmaceuticals where we've been able to identify the specific compound, the specific chemical, and really as a targeted approach to be able to treat a particular disease segment. But we've also started to realize is that if you take any particular lever and you push it too hard, it has different consequences. So for example, you may have an immunological agent, which is great to get rid of that autoimmune disorder, except now you have side effects of being able to get secondary cancers, secondary infections. And that's true for most of the pharmaceuticals that we have. Very good, very specific. The problem is that you're just pushing one lever significantly versus multiple levers gently. So it's much better not to kind of put a huge stress on the system by making a sudden change, but to really help the system itself, the entire body, slowly be able to adapt through multiple levers that actually work in synergy. So there's been this kind of confrontation between pharmaceutical and nature-based or much more naturally produced products. One of the issues has been that in Western pharmaceutical-based approaches, we've been able to actually perform clinical studies where we're able to identify not only the compound, but how does it work, what are the doses that are effective, and what are the potential side effects. What's been missed quite a bit when it comes to naturally based remedies is that clinical rigor hasn't been there. And therefore, it's been difficult to justify it from a scientific perspective to the same degree that we can pharmaceutically based formulations. So if you're to use a compound, does it really work? Or is it just, what we believe it's going to do? Has it actually shown clinical efficacy? What are the effects? What are the side effects? And what are the proper dosages for people? And can you actually then go ahead and personalize that? So I think where the opportunity is to be able to marry these two or be able to complement the two different approaches. But what needs to happen from a nutraceutical perspective is that we have to apply some of the scientific rigors of Western medicine, clinical research, outcomes, gathering more information, and refining these modalities so that we can be much more specific in regards to how we target health optimization for patients. So I no longer really find them to be butting heads, but they can actually complement each other so that patients can have a much better outcome.